Okay. Okay. So we know about bones, right? You guys are very familiar with bones? Yes, no, maybe? What are bones for?
To hold up the skin.
To hold up the skin. I like that. That is a very good answer. So they're basically used for holding up the skin. Anything else?
To help us move.
Help us move. Yeah. Okay. So they're used for leverage and muscle movement and stuff like that, right? Okay. Good. 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 Okay. So we're going to be talking about bones. We're going to talk generally about the bone structure and everything like that, and its relevance towards excuse me, its relevance towards its function. Okay. Excuse me. Okay, so here on this slide, we basically have a kid looking at a bone, right? And so looking at a fossil. So here, in this case, this is a fossil of a crocodile. And we know that a lot of bones are basically used for study. And so we know that it's used for studying the structure of former beings and stuff like that. In addition, we know that bones itself is going to be, in terms of that process, is used for understanding how we develop, grow, and develop. And so our bones are going to be changing throughout that process. And so there's going to be that changing factor throughout that process. And they're also going to be used for that support and the function, right? So they're going to be growing as well as developing through that process of just that growth, right? Does that make sense? I don't know.
Yes.
Okay, so you've already told me that bone basically supports movement, right? So it's going to be necessary for actually that functional aspect of things to sit there and get us to move across the room, for weight, for things to that extent, right? Bones are also used for what? You said, somebody said it supports skin. Anything else that it's used for?
Protect your internal organs.
To protect our internal organs, right? So what keeps our lungs from being punctured and stuff like that? We have bones that sit there outside that also acts as means of protection as well. Right? So like here, in the case of the cranial, it's basically our brain is surrounded by bone. Sit there and keep us from having head traumas constantly. Okay, so here we basically have an orthopedist. An orthopedist is basically a doctor that studies bones, that is specialized in the treatment of bones. So in this case, a orthopedic basically prescribed a brace for reinforcement of that bone structure. So even our bones sometimes will need support to keep us from doing damage or to allow time for it to heal. Okay. So when we think about the bone itself, so this here basically is the head of the femur. And so it basically shows us that the bone is made up of different components, right? And different tissues. So up here we have the outer surface. So up here we have the outer surface of the bone. On the inner part, we have what we call the yellow marrow, which is here. And then we also have the red marrow. Now, the composition of the yellow marrow and the red marrow are going to be different. In the yellow marrow, that's basically where we're going to have fat storage. And what do we use fat storage for?
Keep us warm.
Keeps us warm, yeah, okay. So anything else?
Energy.
Energy, yeah. So it's storage of energy, right? So, and which we kind of use for keeping warm and things to that extent. So if you think about it, so you guys know the marrow. How many of you guys eat chicken?
Yeah.
Yeah. Okay, so do you guys ever use the bones to make soup and stuff like that, and like break the tips of the bones and take the marrow out?
Yeah.
Yeah, I've heard of that. A lot of Thai people from Thailand do that a lot with their soups.
Yeah, yeah, I love bone marrow. I break it, I chew the bone, and then I suck out the marrow. Now, part of that is it has that fat storage in the center. The other part of it is it's going to be for hemopoiesis. Hemopoiesis is basically the formation of your blood cells, right? So bone marrow is essential for that lineage of blood cells that are going to be generated. Okay, does that make sense? Okay, so so your different blood cells that are going to exist. So these are a lot of the cells that are going to be involved in your immune system and stuff like that. So your B cells, they're going to be your red blood cells, your white blood cells. Okay, you guys are familiar with those?
Yes.
Okay, so part of the function of the bone is not only for that protection, but it's also, well, I guess it is for protection, but it's also for the production of other types of cells. Okay, so it kind of serves a dual function. Okay, a lot of the bones that we have are they're gonna be classified based upon shapes. We're not gonna focus on that part of it. I just wanted to let you know that a lot of the classifications, their names, are based upon the shapes that they form. Long bone, right? Short bone, you know? So it's their shape that they're actually, that kind of describes them. Okay. So depending on where the bone is going to be located at, its function is going to be different. The ligaments, the tendons that are going to be attached to it, and then also the blood vessels and the nerves that are going to be penetrating it are going to be different. Okay, and so that all plays a part in that anatomy and understanding that anatomy, but their function is going to be dependent on that as well too. Okay, so does that make sense?
Yes.
Okay. So bone basically starts, from bone cells. And so these are the 4 types of bone cells that exist. So we have the osteocytes, which are basically, they maintain the bone tissue. We have the osteoblasts, which basically forms that matrix, that outer matrix out here, the outer part of the bone. And then, and so a lot of the calcification and stuff occurs as a result of the osteoblasts. We have the osteogenic cells. So those are basically stem cells. Those are cells that are able to turn into other types of bone cells, right? So it gives it that flexibility. And then we have the osteoclasts. So those are basically responsible for reabsorbing bone. So when we need to kind of start growing a little bit more, we have to reabsorb some of it so we can expand and redevelop those matrices. Does that make sense? Mm-hmm. And it's kind of cool because you have all of these cells that are responsible. They have their specific function just for the bone, right? Kind of like what we have for all of the other tissues that we've kind of ran into. Okay, so this is basically just a cross section of a piece of bone, right? And so you can kind of see that the tissue organization is very complex, right? So we have lymphatic vessels, we have nerves, we have blood vessels. We have all of these, what is called spongy bones. So basically cavities, right? And then we have, again, we run into the same type of system here. We have the central canal, so they were able to sit there and get some nutrients and stuff to the bone, within the bone itself, right? And so, like the other tissues that we've encountered, kind of like the skin itself, it's gonna have some complexity to it as well, okay? And it's gonna be a combination of various because the bone needs nutrients. It needs to have like, how many of you guys have hit your funny bone before?
Oh yeah.
Knocked it on something.
Oh,
You're
wow.
humorous.
Yes. And so you feel it, right?
Yes.
And so why do you feel it?
I was actually going to ask you that question.
Because if you take a look at the matrix, you have nerves and stuff in there as well too, right? And so you have nerves within the bone that are integrated within the bone itself, because you need to be able to sit there and get that sensing of things as well. So you have those signals that are being drawn there as well too. So that are going to be delivered, telling things, hey, man, you just knocked the crap out of your bone right there, right? Or have you ever, like, I do this all the time. I always, like, the side of my bed, I'm not paying attention, and I cut it short, and I hit my leg at the end of the thing, and particularly the bony part of my leg. For some reason, I always hit that part, and it hurts like a mug, right? Your bone hurts. It's not just the skin. It's your skin and your bone that you're feeling, right? Yes, no, maybe.
Yes.
Yes.
Okay, so that basically lets us know that we have nerve endings that are there. We have blood vessels that are there. We have lymph nodes that are there, because our bone also can get sick. It also needs to have that protection, so that's why the lymphatic system is going to be part of that process. We need blood to sit there and provide some of that nutrients for it to sit there and continue to grow and develop, right? Okay, so this is basically just a picture of that of the spongy bones, right? And so you'll notice that the red marrow is basically going to be filling, and kind of see it here. It's going to be filling the open areas of the spongy bone. Okay, so then that's where your red blood cells are going to start being developed. Okay, and so those monocytes that are being developed in this process are also going to be used to sit there and make some of those bone cells, in addition to being able to sit there and make some of your blood cells. So that means that your blood has to be able to get in and out of there, right? And so that some of that matrix component and those vessels are going to be responsible for that. Okay. Okay. So since we are, so the skeletal system plays a key component in terms of our movement, right? So there are certain diseases that are going to be associated with our bone development. So one of them is called the Paget disease. So in this case, you can see this is a normal individual, but this person is kind of bow-legged, right? And so we often refer to them as being bow-legged, but that bow-legged is typically a result of that the bone not forming correctly. So the bone itself is going to be more porous, meaning that there's going to have a lot more of those gaps in it. And it's also going to be very, very curvy. Now, that's going to affect the integrity of those individuals. Those people are going to have more cases of themselves running into bone breakage in that situation, because again, it's more porous. It's not as dense as a normal bone would be. Bones are typically not too dense in the first place. The fact that you're making it even more porous than now, that's going to make fractures to happen more frequently. Okay.
Is this a disease that you develop or it's passed on by your parents?
What was that? Yes, it is passed on. It's a genetic disorder. That is correct. Yeah, so this is a genetic disorder that occurs. Okay, and there are also viruses. There are also viruses that can cause this disease as well. So, and the problem is that nobody knows what virus it is yet. Okay. Okay, so as the bone ages, the bone actually becomes a little more brittle. And part of that is because, you know, the fact that it is porous, the nutrients are being kind of flushed out faster than what it should be. So that also is going to play a part in it. It becomes cold and warm. Okay. And the thing is that because these individuals have to be very cognizant of their weight, because any overweightness could cause the breakage, easy breakage and stuff like that. And that's pretty much it. Let's see. Okay, so this here is, and again, we're not going to go too much into the anatomy, but I want to emphasize the fact that how the bone is kind of integrated. You have your nerve and your blood cells that are going to be there for supplying things. So your blood is going to be supplying the nutrients. Your nerve is going to provide the stimulations to tell you what you need to be doing, and then also to kind of receive, hey, something is wrong. You know, hey, I just knocked my elbow on the table, and so my funny bone is acting crazy, right? So we're going to be integrating these systems together. And so we have the skeletal system that's also going to be integrated with the vascular system, and then also the nervous system. Okay, so okay, so this here is basically a slide that shows us cell clusters that are kind of grouping together. So in the very first one, this is from intramembranous ossification. It's basically occurs in 4 steps. The very first one is the mesenchymal cell group is going to be forming into these nice little clusters. And so you'll have your cells here, you'll have your cartilage, and then you have your ossification center. Ostenoids are just basically they're like vesicles that are going to basically be filled with calcium that is not connected. So it's not calcified yet, it's not hardened. And so they're still kind of soft and smushy. And so these osteoblasts are going to be secreting them, right? And so they're going to be secreting these little vesicles that have that calcium that you're going to be need for the ossification. So then your osteoblasts are going to get organized, right? And so then they're going to start forming that nice little ring structure, okay? And then your osteocytes are going to be centralized. And then they're going to be responsible for forming that matrix. So they're going to start taking some of that calcified calcium, those osteoids, and it's going to start being utilized to start forming the matrix, the new bone matrix. Okay, then you're going to get your nice little matrix formation, right? And so you're going to get your trapecular, trapecular structures forming. You're also going to get your blood vessels. You're going to actually start integrating within the matrix itself. And then towards the end of it, you're going to get the different layers that are going to be forming. So you're going to get your red marrow that are going to start being formed here, because your blood vessels are going to start providing the entryway of providing the route for those those blood cells that are going to be produced to go into the bloodstream. And then also you're going to have, and then where your vessels themselves are also going to be providing the nutrients and stuff for the continued growth of that. Okay, so for the endochondral ossification, so the inner parts of the bone, essentially. So that occurs in 5 steps. So we have the 4 steps and the 5 steps. So then we have the mesenchymal cells differentiate into chondriocytes. So let's see, where's my? So we go from this point, and then we start getting some calcification occurring. And we have, initially we have some of that uncalcified matrix, but then we have the calcified matrix, and the uncalcified matrix becomes a little more calcified. And then the cartilage, so the cartilage basically starts forming the cartilage basically starts forming the bony skeletal parts, and then the perichondrium starts to form. So, and that would be the perichondrium starts forming a little bit more, and then and C, we have the capillaries penetrate the cartilage, and then the perichondrium transformed into the periosteum. So this outer layer becomes a little more solidified. The periosteal collar develops. So these guys start to develop, and then your primary ossification at the center starts to develop. And then in D, the cartilage and the chondriocytes continue to grow at the ends of the bones. So you start getting more of your chondriocytes and your cartilage forming towards the ends. And and then you have your secondary ossification center develops. So secondary. And then you kind of notice that you'll start getting your veins and your arteries that'll start being in there, as well as some of the nerves, the nerve endings. And then the cartilage then remains at the epiphyseal plate, and then it joins to the surface as the articular cartilage. So, and then that's kind of shown here. So this here is where the articular cartilage ends up. And so, okay, so chicken bones, right? Chicken legs. How many guys, chicken legs? Familiar with the chicken leg?
Yes.
Yeah.
Okay, so that's like my favorite part of the chicken. So if you guys eat towards, eat through the muscle, at the very end, the part that nobody ever eats at the very top. So that is the same area that we're talking about in that regard. And so basically, as our cells develop, they have to develop to that point where they completely develop that cartilage, right? Now, that cartilage, there are a couple of things that I do want to talk about regarding that cartilage during its development. So we initially get that initial set of cartilage, that initial part of cartilage that we have. So we have the articular cartilage that is there at that surface. Now, over time, that cartilage gets worn down and gets broken down. And initially, when you're young, your body does a pretty good job of trying to regenerating it after a while. But there's a point as we get older that we no longer regenerate that cartilage, okay? So between those two joints, okay? Does that make sense? And because of that, we end up having issues. We can end up having cartilage that are tearing and stuff like that. And so then it'll cause pain and joint distress. Okay, because it's no longer regenerated the way that we regenerated when we were a kid. So, and that typically starts happening like in your early to mid 20s. So you'll start noticing that you'll have issues with growth, cartilage growth and development. Okay. Okay. So let's see. Okay. So in terms of long bone growth, so the epiphyseal plate, the one that we just kind of talked about briefly, it's also going to be responsible for that longitudinal growth. Okay, so for us to get that length, that process is going to kind of continue on the other end, and you'll notice that your chondrocytes are going to play a major part in it, but it's also going to start using some of those nutrients and stuff like that we kind of talked about prior. So you're going to be using your lipid, your glycogens. You're going to use the you're going to have certain signaling molecules, such as alkaline phosphatases, that are going to be accumulating within this matrix here too. Okay, and part of that is so that it kind of tells us, hey, yeah, in terms of your growth, it helps us remember that growth is something that's going to be happening and developing through the time that you're like in your youth up until you're in your 20s. Okay, early 20s. Okay, and so these molecules here, primarily, so the alkaline phosphatase is used for signaling. It's a signaling molecule. It tells cells to continue growing or to stop growing or to do those things. And so you have a high accumulation of that. And over time, that accumulation is going to change. Okay, so fracture types. You guys are familiar with the term fracture. Fracture meaning break?
Yes.
Okay. So our bone basically can be broken. Bones can be broken. And so there are various fracture types. The bones also repair. And over time, they can repair themselves if depending on how bad the fracture is. Okay. So this here, if you look at the very first one, this is called a closed fracture, right? Closed fracture basically means that you have a breakage, but you don't have displacement of the fractioning parts. So if you kind of take a look, it's still kind of aligned. Where an open fracture is where you have breakage, but you have displacement of the bone. Okay. Transverse fracture, basically you have the bone impacted upon itself, causing it to crack or to break. Okay. Spinal, kind of like a diagonal or it's a spiral. It's kind of like a diagonal fracture. So it's more, your bone is still, the center part of the bone is intact, but the outer part has been kind of fractured. So you still have some contact between the bones, but it's breaking more in a a spiral manner, you know, along the outer part of the bone. A comminuted fracture. That guy is, it's basically, it's broken in several little pieces, okay? So it's a fragmentation of the fracture itself, so many little pieces. An impact fracture, again, is like instead of up here where you have the transverse, where you have compression on both ends, and an impact fracture, it's only like say you land it and it pushed to cause a breakage. The green stick fracture, it's not a complete break. You only break part of the bone, so only part of it has been broken. And then an oblong fracture, it's still in the skin, and so you had no, it's still aligned. It's kind of like it's pretty much still intact. The only thing is that it's broken, but it's still intact. And so you don't have any, it didn't protrude through the skin at all. Okay, does that make, I'm sorry. It didn't protrude in the skin, and it's also, it's at an angle that isn't 90 degrees. I'm sorry, oblique, not oblong, oblique. Okay, so those are the different types of fractures. So now repair. So the first thing that happens during repair is that you form the hematoma. Okay, a hematoma is basically where you're starting to get your blood clotting to occur. So you're getting clotting at the point where the bone has actually fractured at. So then you're going to start forming your new blood vessels. You're going to form what's called the internal callus, and you guys are very familiar with calluses already. So these are going to be calluses that are going to be internal on the inside of that structure where the two bones have fractured. You're also going to form what? Are you guys there?
Yes. I was gonna mention, is that why it kind of swells up when
Yes.
you break it?
Yes, that is exactly why it swells up when you break it, because the hematoma is actually forming. So you're just getting a lot of blood rushing into that area. And so your blood is there for, like I said, it's for multiple reasons. One of the things is to start clotting that area. It's also going to be providing some cells that are going to be to replace that area. Now, your bone, the way your bone is, because your bone exists there, you've already broken some of those blood cells, right? And so that also causes that formation of that blood to kind of go out the way it is. And so your blood, I'm sorry, your blood vessels, not your blood cells, your blood vessels. Now, your body's going to sit there and try to clot that area as soon as it can. And so that's the other reasons why you're getting all of that blood rushing in there is going to start clotting immediately. Okay, so you're going to get the formation of your new blood vessels. You're going to get the formation of your calluses, right? And then also you're going to start making some of that spongy bones fragments that are going to be sitting there, going to go into that area to kind of act as that matrix for repair. Okay, so then you're going to get more of that, what they call it, the bony catalyst. So it's going to be more of those spongy bone fragments that are going to be entered in there, and then they're going to be producing those cells that are in that bone matrix. There's going to be producing more and more cells in that matrix. reform that matrix itself. And then your fracture is pretty much going to heal. Okay.
Then
So,
the blood
go ahead.
vessels are what connects the bone together, technically? Like bring it together when it breaks?
Yes, so it is. So the spongy bone is going to be what is going to do that. So the spongy bone itself is just a combination of the osteocytes and the osteoblasts, and so but they're going to be clustered together already. So they're going to act like little islands to kind of act as like just little matrices. Have you guys ever built a crystal, or like had seen a crystal form?
Oh yeah, I think it was like with sugar.
Yeah. Okay. So you see how like where you can start, you'll have certain spots where crystals will continue to grow,
Mhm.
right? So in the context, you're putting like these little nucleating sites there within that matrix. And so what happens in those nucleating sites, they continue to grow more and more cells to sit there and remake the matrix that is there. Does that make sense?
Mhm.
Yes.
Dr. Harry,
I
so
like
for
it.
this process, the body's gonna try to heal the bone.
Yes. So the body actually does heal that fracture.
So, but in all cases, is it gonna actually work, or is it gonna need some special more treatment?
So in some cases, you're going to have difficulties, right? So depending on the breakage of your bone, like for instance, if we had an open, right? So in the case of an open fracture where the bone is actually penetrated, it's going to be hard for it to sit there and heal itself, right? So you're not going to be able to form the hematoma because you have a bone sticking out of your muscle, right? Or out of the skin. So it has to be, in those contexts, it has to be realigned. It has to have the ability to reform that hematoma. So the harder it is for it to reform that hematoma, the harder it is to repair. And then also, like minor fractures, right? So in the case of like, let's say the spiral fracture, where it's just like we've basically broken the outer portions of the bone, because typically that's like a twist or something like that, where you've knocked it that way in the case of the spiral, right? So those guys are like a lot harder to repair as well, because the blood vessels that are, you're going to break some of the blood vessels, but the primary ones are not disrupted. And so you're not going to get that full hematoma sensation. And so it's more like, in this case, kind of like a little fracture, a small fracture rather than a large fracture. And
So it's gonna depend the trauma the bone have had.
Exactly. So in most cases, like doctors will sit there and say, it's better for you to have, rather than you just having like a little fragment of that bone broken, it's harder for it to repair in that context, where if you have a clean break, it's easier for it to repair because the hematoma will actually go in there and repair that entire thing, where it's harder for it to sit there and reestablish those little blood vessels in that small area that you're doing. Does that make sense?
So that's why doctors sometimes recommend you, okay, you might have to do some physical activity with some
Well,
operation. It depends.
Often doctors, what they'll do is they'll actually break your bone completely. So, and then they'll go in, because you don't have a complete fracture, they'll actually go in and break it completely, and then kind of put a stent on it and put it in the cast, so then it actually can form that hematoma and go through that process. So because, or re-break your bone because it didn't heal the right way, right? Because if it was slightly off, you had a bad healing, or it was slightly fragment, it didn't heal correctly. So they'll go back in and break it and align it so that it will heal correctly, or give it a complete break.
It's freaking amazing that our bodies can do that.
Yeah, it is. It's really cool if you think about it, though. Let's see. Okay, so I kind of skipped through some stuff here. Hold on. Okay, so our body kind of needs vitamin D, right? And vitamin D is also very important for our bone development. And so the way that we get most of our vitamin D is actually via the sun. We can also get it from food, you know, milk, vitamins. But the amount that we get from like supplements and stuff like that isn't as much as what we would get from the sun, and your body kind of provides it entirely. And so vitamin D is responsible for calcium absorption, which is needed for bone formation. And so we kind of need a lot of that, you know, to sit there and help rebuild bones. It keeps our bones strong, you know. Okay. Let's see. We're almost done here. Get my slides to work.
So at the same time, we need sunlight, but at the same time, we don't want to be outside the whole day. And
Exactly, right?
Okay.
Exactly. So you need a little bit of sunlight to kind of get that process started. And then, but you don't want to have too much sun. That's true. And so you definitely want to make sure you're wearing your sunscreen when you're out there. Yeah, and it basically stimulates the production of vitamin D, so our body's able to sit there actually. And sunlight is a part of doing that. Otherwise, we'd have to get it from supplemental sources.
So
Okay.
it has its pros and cons.
Yes, it does. It does. Of course, you know, that balance, right? Okay. So this here basically shows us a graph, and it gives us like a bone mass at ages, right? So this is a male, this is a female. Female's in red, male's in blue, and this gives us the total mass of skeletal calcium in grams. And so you guys can see in the beginning, your bone mass is not that much, but you guys start to peak in your 20s. We start to peak. All right, so our early 20s or so, early to mid 20s. So, and then for men, we kind of start leveling off, and then we start shooting down. For women, because your 20s technically should be your childbearing age, and so you'll actually continue. Well, you'll continue to peak just a little bit more, but you kind of level off, and then you'll start going down drastically. And so you'll start losing more and more bone mass when you start hitting menopause. And then so our bone mass decreases as well, but it's not as drastic of a drop in terms of being a male. Okay. Questions, concerns, Cash? Yeah.
Is there like a reason why females drop more than men?
Yes. Because the earlier part of your body formation, because your body's taking into account the fact that you're going to be bearing children, right? And so, but there's a point where your body is no longer, it's not ideal for it. And so during that time period where you'll notice like in your 50s and so you're not going to be having kids at this point. That's what they're basically saying. Our body starts dropping the same way, but you have a more drastic drop. So it's thought that women don't, well, your body says you don't need as much weight anymore, or as much mass or much strength to sit there, because you're no longer have to support bearing a child. And so you can actually be leaner and lighter, and not, your mass doesn't have to be as big, your bones don't have to be as strong. And so it's more of that, the genetic differences between male and female that are causing that drop to be more dramatic than that. But if you look at it, like the drop rate is going to be the same, but you just have that dip, that drastic dip. You guys actually, you stay comparable, right? But like you have a point where your mass is like, pretty good. And then there's just that dramatic dip at that point, right? But then after that, you're pretty much comparable at that point, you know.
Then as we get older, then women are more prone to break something than men are.
Yes,
when fall.
yes, because your bone mass is typically less, but typically women are mass-wise are also less than men, you know. So men are thought to have more muscles associated with us, so on and so forth.
That's not
So
fair.
what was that?
I said that's not fair.
Yeah, well, genetics. I'm sorry, you know, I can't control that. So things that are going to affect your skeletal system. So those are going to be kind of like, you're going to have various hormones that are going to be responsible for affecting them. We know that obviously sex hormones play a huge part in it, right? Based upon this graph. We know that just our growth hormones are going to play a huge part in it because we all see at the beginning, we grow. And then we're going to have tyrosine, which basically is going to be responsible for stimulating bone growth and promoting synthesis of the bone matrix. We have calcium-trinol, which is going to be responsible for the absorption of calcium and then phosphates that are needed for digestion. And then we have, let me type these out for you. So we say growth hormones. We have sex hormones. We have tyrosine. We have, and you'll notice that when you get to a certain age, you'll start using supplements, or doctors will start prescribing like calcium-trinol, right?
It's in your early 30s.
What was that?
I go, it starts in your early 30s.
Yeah. And then we have, sorry. And then we have para. Hormone. So this guy, the parathyroid hormone, basically that stimulates the proliferation of your osteoclasts, and which are responsible for reabsorption of bone. And then you have your calcium. Okay, and then you also have your calcitonin, which basically inhibits that absorption. So, okay, and so, but that means it stimulates. It also stimulates calcium uptake by the bones. So those are your hormones. And lastly, so this process is, there has to be regulation of your calcium homostasis, right? And so too much calcium can be a problem. Too little calcium can be a problem, okay? So you need to try to keep it at a normal level, okay? So our thyroid glands, let me see if I have that. Can I see? I deleted. Yeah. So our thyroid, oh, there we go. Okay, so our thyroid glands are responsible for producing these hormones, right? So we have the thyroid gland itself that's responsible for releasing the calcium-trin. The parathyroid glands are responsible for releasing the parathyroid hormone. And so calcium levels decrease, it causes, if our calcium levels decrease, it gets too low, then we're going to be producing this guy. We know that this guy will actually, it'll inhibit osteoblasts. Let me make sure. This guy, it stimulates the osteoclast and it releases calcium from the bone. Okay, so then calcium is going to be reabsorbed into our urine and then our kidneys, and then calcium absorption into the small intestines, and then that's also going to be increased by vitamin D synthesis. So then our calcium level in our bone is going to increase. Okay, and then if our calcium level is increased, then we're going to inhibit the osteoclast activity, and then calcium is going to be reabsorbed into the kidneys. The calcium is going to be reabsorbed, and then in the kidneys you're going to get a decrease in calcium. So you're going to get calcium basically being reabsorbed into the bone, and then the kidneys decreasing calcium. So then your calcium levels in the blood are going to basically decrease. Okay. So increase in calcium levels, this system is turned on. A decrease in calcium level, this system is turned on. So then in that context, we always try to maintain that normal level. And this is kind of like the golden goose for this section right here. No questions? Okay, so then I'll see you guys next week. I'll see you guys on Wednesday.